What is going on, everybody? This is Medicosis Perfectionalis, where medicine makes perfect sense. This is video number 3 on my playlist called Ever Wonder Why? In the last 2 videos, we have talked about why is hagma normochloremic and why is nagma hyperchloremic. Today, we'll talk about the fact that the pain of the duodenal ulcer usually improves when you eat. Ever wonder why? What is peptic ulcer disease? Basically an ulcer in your stomach or duodenum, maybe the lower esophagus. The gastric ulcer pain worsen when you eat, but the duodenal ulcer pain improve when you eat. Why? Before I answer you, let me give you 5 questions. Number 1, what's the number 1 cause of peptic ulcer disease?
Oh, I know, Medicosis. It's eating chocolate, drinking coffee, mint, eating spicy food.
Shut the French toast up. No, nonsense. The number 1 cause of peptic ulcer disease is the stinking Helicobacter pylori bacteria. Second question, which one is more common, gastric ulcer or duodenal ulcer?
I know, Medicosis. Of course it's gastric ulcer.
What an absolute piece of melon, no pun intended. Nope, the answer is duodenal ulcers. Duodenal ulcers are way more common than gastric ulcers. Question number 3, what is a common cause of underdiagnosed cause of acute abdomen found in autopsy? So the story went this way. You had a patient coming to the hospital. Very severe abdominal pain. You could not make the correct diagnosis. The patient died. On autopsy, you discover the cause of the pain. What is a common cause of that underdiagnosed cause? And the answer is a perforated peptic ulcer disease. Question number 4. If a patient has a peptic ulcer disease, is he or she more likely to have diarrhea or constipation?
That's a difficult one. I've no clue.
Alright, peptic ulcer disease is an ulcer, right? Yeah. It can bleed. Well, no kidding. You have removed your epithelium and your basement membrane, exposing the blood vessels. So, of course, they can bleed. And blood is cathartic. Blood causes diarrhea. Blood is not constipating. Blood is cathartic. Iron is constipating. So if I'm taking too many iron tablets, I can get constipation. But if I'm bleeding, I get catharsis, which is diarrhea. So vampires get diarrhea all the time. Question number 5. What if my patient has an acute abdomen plus syncope? So severe abdominal pain and fainting. What's the differential diagnosis? The answer is, it could be one of the following. It could be a perforated peptic ulcer disease. It could be acute pancreatitis. It could be ruptured aortic aneurysm or ruptured ectopic pregnancy. Last question. Which one is never malignant? The gastric ulcer or the duodenal ulcer? The answer is the duodenal ulcer. And that's why there is no need to biopsy a duodenal ulcer because it's never malignant. It's not like 100% never, like the chances of a duodenal ulcer being malignant is infinitesimally small.
Why is this, Medicosis?
Easy. Do you remember when we talked about the labile cell, the stable cell, and the permanent cell?
Yeah.
The cells of your duodenum are labile like it's nobody's business. They divide like crazy. They keep dividing and they keep getting sloughed off into the stool. So even if a cell had a chance to have some dysplasia, boom, it's in the stool. You will not have a chance to have cancer. And that's why basically all of the chemotherapy medications cause diarrhea. You know why? Because your duodenum and your gut in general has a very high cell division rate. What does chemotherapy do? It inhibits cell division. Who's gonna suffer? The cells that divide the most, including your hair, so you become bald, and your gut. You get diarrhea and nausea, vomiting, etc. Now to today's question. Why does the pain of gastric ulcer get worse when you eat, but the pain of duodenal ulcer gets better when you eat? Here's the deal. When food reaches the stomach, okay? What's going to happen? The pyloric sphincter will constrict, leaving the food in the stomach, and the stomach will do its mixing action, some peristalsis, to actually digest that food. When the sphincter is closed, the food remains in your stomach, but there is no food in your duodenum. The acid remains in the stomach, but there is no acid in your duodenum. And that's why the gastric ulcer pain will worsen when you eat, because the food and the acid are in the stomach in contact with the stomach ulcer, but the duodenal ulcer pain will improve when you eat because the duodenal ulcer is free from the acid and away from the food. So imagine the 2 patients walked into your office. The first patient had what? Had epigastric pain, and when you ask the patient, oh, this epigastric pain is way worse when I eat. Once I eat, it's horrible. Especially if I eat at night. Especially when I lie flat on bed at night. Especially when I wear tight clothes. This is gastric or lower esophageal due to GERD. The second patient came to your office, doctor, if I eat last time at night at 8 p.m., I'll be fine. I'll be so happy with no pain. Actually, when I eat, the pain is gone. The pain improves when I eat. And then I go to bed. But I will wake up at night because of severe epigastric pain at about midnight. Such is the pain of a duodenal ulcer. See, medicine makes so much sense once you understand what the flip you're talking about. And now to today's question. How can you eradicate the freaking stinking H. pylori that is responsible for about 70% of cases of peptic ulcer disease, and in some parts of the world 90%, 90. That's like all of them. Let me know the answer in the comment section. If you like this video, you will love my Utacoids pharmacology course, in which we discuss the management of peptic ulcer disease. We talked about serotonin, cyclic AMP, histamine, etc. Use promo code histamine to get a 40% discount for a limited time only. Thank you so much for watching. Please subscribe, hit the bell, and click on the join button. You can support me here or here. Go to my website to download my courses. Thank you for watching. As always, be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.